between symptoms and disorders. There is difference between symptoms and disorders. Yeah, so someone might be sad, but sadness is something, depression is something different. They are very, very close to each other, but both are completely different. So how can we differentiate between symptoms and disorders that need treatment? So by looking for the function. Is the function of the individual is impaired or not? If yes, then we are dealing with a disorder. If not, it is most likely it is just symptom. So for example, someone having some sadness or is not feeling normal, like sad, anxious to some extent, but he goes to work, he does all his usual activities the same with no change. He comes to prayers on time. He is able to have some fun sometimes, playing soccer or whatever, but he is just sad. As long as there is no impairment in function, we don't care much about that. This is temporary and will go away. We should not pathologize that, and we should not label that as an illness and that needs treatment. No, it is not. As long as the function is intact, you're good. So mood disorders, we have major depressive disorder, bipolar disorder. Major depressive disorder is when there is depression. Depression means depressed mood, decreased interest in doing things, lack of energy, poor concentration, poor sleep, poor appetite, or increased appetite. Some people, when they are depressed, they eat more. Some people, when they are depressed, they eat less and they start having weight loss. So they might start to have suicidal thoughts and suicidal attempts and self-harm behavior and so on. Bipolar disorder includes two sides. Depression side for a few weeks to a few months, and then that goes away, and then the other side comes. The other side is completely the opposite. Very happy, excessively happy, on top of the world, full of energy, very impulsive, decreased need to sleep. It is not lack of sleep, decreased need. They don't need to sleep because they have a lot of energy. Overspending money, maxing credit cards, doing out of character behavior, getting into illegal troubles, legal problems. So there is impairment in function here and impairment in function here. This is what we call bipolar disorder. It's either down or up. And there is normal in between. So there is high genetic factor on this, reaching up to 20% in cases. This is one of the highest this is one of the most genetic-based disorder in psychiatry, one of them, bipolar disorder. So again, the depression, as I said, irritability, sadness, loss of interest, fatigue, appetite change, sleep problems, suicidal thoughts. In adolescence, they might say they are sad. They might become just irritable. So bipolar disorder, the manic phase, or what we call the manic phase, the high phase, the depressive phase, there is risk of doing some inappropriate behaviors, including substance abuse and sexual indiscretions and stuff like that. Anxiety disorders, we have like generalized anxiety disorder. That's excessive worry, someone who is excessively worried. If you have an exam at school, you might feel worried the night before or the week before the exam. As long as this anxiety makes you study more, it's completely normal and it's physiological. It is not something that we would label as a disorder that needs treatment. But when it stops you from studying and stops you from going to the exam to begin with, now we call it's a disorder and it needs treatment. Anxiety, excessive worry, out of control, irrational worry, worrying about things that might not happen. For example, someone would think about, he has excessive worry that the fire might get into fire. And because there is something plugged into the electricity so looking at something plugged in and becomes very worried that a fire might happen. Something very irrational. It's very extreme and associated with other physical symptoms like shakes, racing heartbeats, muscle tension, and usually certain kind of headache like a band-like headache or shoulder heaviness, neck pains, fatigue, panic attacks like discrete episodes of anxiety. For example, going to fly to your home country, so you find you have this discrete episode of anxiety, what we call panic attacks. So or panic disorder. Social anxiety disorder is when you are in a setting like this with a group of people, you start to feel panicky, you start to feel too anxious and shaky, and you cannot continue. You cannot continue a presentation like this. But it's normal to feel some anxiety in the beginning, but as long as you do the job, you're fine. It's normal, physiological. But when it is pathological, when it interferes with your function, prevents you from doing things. Phobia is another form of anxiety. Some people are having extreme fear of using the elevators. They cannot be in closed spaces. They cannot look from the balcony. High places would make them feel dizzy and very anxious. Some people might have extreme fear of dogs, cats, snakes, and so on. So these are common in adolescents due to heightened self-consciousness and the tendency to question their kind of abilities. The adolescents are very self-conscious, how they look like, how people perceive them. You know, again, that refers to the stage that we talked about, the narcissism during adolescence. Narcissism being self-conscious, being too self-conscious, that might lead to this kind of anxiety in group situation. Presentations at school, making presentations in front of the classroom. Some adolescents find it very difficult, extremely difficult, and they ask the teacher to make the presentation just for the teacher only. So when it reaches to that level, we say, oh, this is an illness that requires treatment, and the treatment is easy. There are certain medications and certain kind of psychotherapy. So obsessive compulsive disorder or OCD, when you have like repetitive washing, repetitive cleaning unnecessarily. You wash your hand 100 times, 50 times, up to the point that your skin becomes affected and you have abrasions and wounds in your skin. So it's a kind of extreme way. So excessive clean. Washing your hands once or twice or 3 times, 5 times a day is not a big deal. But when you feel obliged to do it, despite that you know it is clean, but you have to do this, then now it becomes a problem. And it interferes with your function. You become late to go to work because you have to take a shower. And the shower has to be in certain order. You have to wash your body in certain order. And you have to repeat again, and you have to repeat again. Then you become late to go to work. And so when it reaches to that level, no, that's a disorder. Another form of obsessive compulsive disorder is repetitive checking. Doors locked, unlocked, locked, unlocked. You come back and check the door, locked, unlocked. Some patients might come and try to picture the door of the house in order to try to satisfy themselves when they go away, and they look at the picture and then they become suspicious about the picture itself, and they go back, and it becomes like a very kind of it looks like crazy. It looks like very, very irrational kind of. When it reaches that extreme, then it's an illness and it needs treatment. Adolescents might go through certain obsessive compulsive symptoms during that age, and it is temporary. They might start actually to question religion, to question many things in life, and it's normal. It's normal. They might need some guidance, some support, and so on. Not necessarily to be an illness. There is something close to this, obsessive compulsive disorder. There is something called obsessive personality. Obsessive personality is different. Obsessive personality is a person who is very meticulous. He likes his desk to be here, his laptop to be like this, his bag to be like that, and he has to have certain kind of clothing in certain way, and he likes to do that. He is not bothered by this. He is happy to do this. He is happy to be organized this way. Many of successful people having this kind of personality traits, and it's normal as long as it fosters what you are doing and it is not impairing your function. You're good, you're fine. But when it becomes a problem, usually it affects other people. When your wife starts to suffer from it, when you spend too much time to the point that you struggle meeting the deadlines to finish certain kind of tasks at your work, they are usually late to finish, they don't do well with deadlines. Then it becomes a problem. They can be very, very difficult to deal with supervisors. They are good subordinate. If you have someone obsessive under your supervision, that's good. But if your supervisor is obsessive, that can make your life like difficult, because he's very meticulous. He wants things in certain way, in certain order, and so on. So the obsessive symptoms during the adolescence is temporary, and you might see it, and it's completely normal. Eating disorders, usually we see that in females. You find that like a young adolescent, 11 to 12-year-old, she is thin, her body is thin, but she has a belief that she is overweight and she has to lose more weight. And she stops eating, doing strenuous exercise, or making herself sick after eating, so she loses weight, or takes laxatives in order to lose weight. This is what we call anorexia nervosa. It's a very difficult illness, and it has to be treated, because it might lead to serious complication, and it might lead to death for those adolescents. It is common in adolescent girls around the age of 12. Bulimia nervosa, they are not thin. They can be a normal body, but they eat in binges, eat a lot of food in one episode, and then they start purging at least 3 to 4 times a week, every week. They eat and purge, make themselves sick. She might eat with you on the dining table, and then she disappears right away after eating. They go to the bathroom, and she stays in the bathroom for a while, and then find out later that she actually was vomiting what she ate, because she has irrational fear of being overweight, when in fact she is not overweight. This is what we call bulimia nervosa. So we need to watch for that in adolescent girls and adolescent boys as well. Binge eating is another disorder related to the eating disorder, binging without purging. That's the difference between bulimia nervosa. Substance abuse is another important topic, especially here in Canada. You know, cannabis is legalized. Being legalized does not mean that it is safe to use. That's very important. Alcohol is legalized, but it is not safe to use. So substance abuse is very common in adolescents. They try to fit into their groups. You remember what we mentioned about the psychology? They are very keen to fit into their groups, the peers. They try to be like them in order to stay connected and not isolated. So one of the peers is using, they try to use like that person, and so on. So we need to be careful. Nicotine can be the gateway for all drugs. Cannabis can be the gateway for all street drugs, cocaine, amphetamine, alcohol, whatever. Peer influence is #1 risk factor that leads to substance abuse in this age group. Choosing their peers is very important. Parents to have like supervision over the peers of their children is very important. If you see some decline, academic decline, or accidents, or changing friends suddenly, you find your son having new friends all of a sudden, and changing friends all of a sudden, that can be a clue or a red flag that there might be substance abuse involved. Substance abuse can lead to so many disorders, can lead to psychosis, like hallucinations and stuff, can lead to depression, can lead to bipolar mania, can lead to anxiety, can lead to suicide behavior. So there is a full chapter of psychiatric disorders that's called substance abuse and related disorders. So alhamdulillah, in Islam, if you stick to Islamic rules, you are away from all this kind of full chapter of psychiatric disorders. Psychotic disorders, here is a very important one, what we call schizophrenia. The age of onset is late adolescence, around the age of exactly grade 11 here in Canada. Grade 11 is the most stressful grade in the Canadian curriculum. So in grade 11, grade 9, grade 10, but mostly grade 11, they start their scholastic or academic performance start to decline. Any decline in academic performance, once we see that, this is a red flag. We have to meet with the teacher, ask the teacher what is happening at school. We need to understand why is this happening. Academic decline. That can be the first sign. Social isolation. The adolescent starts to spend more time in his room, doing nothing. You can imagine someone sitting in his room just doing nothing for hours. That's very odd. Very, very odd. That may be the warning or the red flag for schizophrenia. And the social isolation, we talked about that, or having some odd beliefs, talking about something very odd, philosophical or pseudo-philosophical, metaphysical, stuff like that. Anyone would hear that, you would say, oh, that sounds very odd. What do you mean? Why are you thinking too much about this, you know? Or neglecting their self-hygiene. They take a shower every day, but all of a sudden, they take 1 week without any showers. There's no showers. Oh, their nails start to be long. Oh, why you are not cutting your nails? Why you are not cutting your hair, you know? So negligence of self-hygiene can be another red flag. Something that is not how they used to be. Any change from how they used to be should be explored, should be understood, what's behind it. Why this is important to detect it early or as early as possible? Because of what we call duration of untreated psychosis. Studies showing that the longer the period of untreated psychosis, the less effective the treatment will be. What is the definition of duration of untreated psychosis? The time from onset of the schizophrenia till the time of starting treatment. The longer this period is, the less effective the treatment will be. So once we discover it early enough, then the shorter this period will be, the more effective the treatment will be. So attention and the behavioral disorders, ADHD, like inattention, impulsivity, usually we diagnose this before the age of 12. Inattention, you can find kids very active, but this is how they normally are. But when this activity starts to affect their function again, the academic performance in school, they cannot sit still in the classroom, they cannot listen, they have very poor marks, they have to get one-on-one teaching at school, now there's a problem. So these symptoms should start before the age of 12. Sometimes it is not discovered until adolescence, and it's very common here in Canada, and we have to pay attention to that. Conduct disorder is a person who is doing psychopathic behavior, lying, stealing, violating rules, or aggressiveness. For example, a kid who catches like a rabbit in the backyard and insists to strangulate the rabbit. So excessive aggression towards animals can be a red flag for this kind of disorders. And later on, what we call antisocial personality disorder. He might end up being a criminal. So oppositional defiant disorder, something very close to the conduct disorder. Hostile defiant, does not listen to you, always you tell him to go this way, he goes this way, and so on. This is what we call oppositional defiant disorder. So usually attention deficit disorder is a diagnosis of comorbidities. It does not come alone. It comes with other disorders like depression, anxiety, and so on. Trauma, like when there is something very traumatic, like witnessing a fire, witnessing someone killing another one, major catastrophic traumatic experience, then the child starts, or the person starts to have flashbacks and intrusive memories and try to avoid things in nightmares, getting up in the middle of the night crying and screaming. This is what we call PTSD. So adjustment disorder, this is very, very common. There is a source of stress and failure to adjust this source of stress. So any source of stress, financial stress, whatever, and then there is an anxiety or depressive symptoms in reaction to this stress. And there is temporal association between these two. Then this is what we call adjustment disorder. Once this is gone, these symptoms will go away. This is completely temporary. So conversion disorder is what we call, the old name for it is hysteria. We deal with that the same as we deal with the smoke detector. You see the smoke detector? When there is some smoke in the house and you beep beep, it goes off, beep 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 beep. The smoke detector itself does not have a problem, but it's a signal to another thing in the kitchen. So the same way is here with conversion disorder. The common example is someone going to an exam, and in the exam he didn't study well, he doesn't know how to answer questions. Then his hand starts not moving, and he say, "Oh, my hand is paralyzed. I cannot use my hand anymore." You know, this is what we call conversion disorder. Physical symptoms, but it is related to psychological stress. Somatic symptom disorder is the same thing. Sadness inside, stress inside you, you refuse to talk, you refuse to open up, and then your body starts to talk about it. And you start to have pain here and pain there, and you go to doctors, multiple doctors, and you don't find anything. So it's just, they call it psychological, it's in your mind. So usually patients don't like to hear that. And they get very offended when they are told by family doctors, it is all in your mind. So the way how we deal with it, it's a real pain. They have real pain in their body. They need to hear that it's a real pain, and we understand how difficult this pain is. But you know what? Sometimes certain kinds of pains might not be caused by physical causes, but it might be caused by psychological causes. Let us talk about how is your life going? What has been stressful lately in your life? And then we'll talk about stress. The more we work on the sources of stress, the better the patient will feel, and the better we can achieve treatment to this kind of, we call it unexplained, medically unexplained physical symptoms. Personality disorders, the most common one is borderline personality disorder. Borderline personality disorder is very dangerous, and in Muslim communities, especially for Muslims, those patients might do behaviors that is very shameful in the community, and it becomes like a real problem for parents. It's a pain for parents. So borderline personality is a person who has like emotional instability, mood swings, dramatic mood swings, sense of emptiness, and self-harm. They usually cut themselves. They get sharp objects and keep cutting. They like to see blood, and they like to feel the pain. Something very weird. It's an illness. And they have suicidal thoughts all the time. They might try to commit suicide every now and then with minor source of stress. They might try to overdose and kill themselves. They have unstable relationships, impulsive, very, very impulsive. They do things very impulsively. So if you see scars in your son or your daughter, you need to ask, how did that happen? What caused that? Any injuries? How did that happen? So mood swings, anger outbursts, slamming doors, and so on. It's a treatable illness, and the treatment should start as early as possible. But the treatment here is mainly psychotherapy, certain kinds of psychotherapy rather than medication. However, medication can help as well. So antisocial traits, the same like conduct disorder, someone who is psychopathic, manipulative, lying, stealing, and so on. Making the diagnosis early on during adolescence can save a lot later on. Suicidal behavior and self-harm. In Canada, every year, 4,000 people kill themselves as suicide. So the suicide in Canada every year is around 4,000 kill themselves. So every day in Canada, 13 persons kill themselves at the rate of 1 every around 2 hours. So suicide can be a result of untreated depression, can be a result of untreated psychosis, schizophrenia, can be a result of substance abuse problem, or borderline personality, trauma, bullying at school, bullying at work. All this kind of suicidal behavior does not come right away. They usually talk about it. They usually express any thoughts of death wishes, or what we call passive suicidal thoughts. We should take this as very serious and try to provide support, take them consultation from a specialist. First one to contact is a family physician. It requires urgent intervention and support. Yeah, so yeah, that's everything. Thank you very much for your listening.
Jazakallah khair.
Remember, yeah.
Have time for questions?
Yeah, that's all for questions. I'm sorry if I took too long. I covered everything.
Jazakallah khair, ya akhi.
جزانا وإياكم.
Are there particular problems, psychiatric problems, social problems within Muslim community which are different than the general population?
I see. Okay. So something specific to Muslims only. In answering this question, we have to go with what evidence showed. So, for example, evidence showed that schizophrenia, for example, occurs in 2%, around 2% of populations, regardless what population this is, either Muslims or non-Muslims. Depression is the same. But I can tell adjustment disorder, for example, adjustment disorder, when there's a source of stress and you cannot adapt to this source of stress and hard to accept it, then you get depression and anxiety. This is called adjustment disorder. From my clinical practice, I can see this less in Muslims because in Islam, you know, we are granted to have concepts like as-sabr, patience, to be patient, al-iman bil-qada wal-qadar. This is fundamental part of our iman and our faith. We say qadar Allah wa sha'a fa'al. We say, this is what Allah wanted for us. You know, we have to be patient. We have to accept it. So, from my clinical practice, I see this less, and Muslims are more protected in this way with regard to this part. The other thing is substance abuse, as I just said, as I just mentioned. But it depends on what you define, how do you define Muslims? You can find so many Muslims, but having a Muslim name does not mean necessarily this person is practicing Muslim. So if we talk about practicing Muslims, no one, I cannot imagine anyone of who is sitting here now will go home and drink alcohol. It's almost impossible, you know? So the chapter of psychiatric disorders about substance and alcohol use disorders and related disorders is completely absent in practicing Muslims. I don't see that in my clinical practice. However, in certain cases, we still might find, unfortunately, some patients having this kind of problems. If we stick to our Islamic rules, we will definitely be more protected from these kind of illnesses. There is studies about praying in congregations, Salat al-Jama'ah. Studies show it, people who are connected to Salat al-Jama'ah are less likely to commit suicide. Either they are Muslims or Catholics. Any religious people who pray in congregation, they are less likely to commit suicide. Suicide so there is also evidence from studies showing that being religious is a protective factor against suicide. So when we assess a patient in the ER having suicidal thoughts, when we see that person having religion, and that religion says, oh, suicide is a sin, a major sin, this can be a protective factor against suicide. I would say, for bipolar disorder, they are almost the same. There's no difference. Major depression, it is the same, because there's a lot of genetic factors that play a role in that. Trauma disorder, post-traumatic stress disorder. Again, we have certain mechanisms how to handle traumatic experiences based on our Islamic beliefs. So Iman bil-Qada wal-Qadar is very protective concept. Patience, being patient, looking for reward from Allah at the end of life, you know, in the hereafter, you know. So all these kind of concepts and fundamental parts of our core beliefs in Islam, I believe it protects against a post-traumatic stress disorder, for example. Grief. If you come to grief when someone dies, and you usually go through what we call grief. Grief is a kind of sadness an experience of loss of a close family member. The more religious a person is, the easier that would be. That's different from someone who doesn't have a religion. I see people from different, most of my patients are not religious, to be honest. Most of them that I see are not religious, many of them. So they struggle when a close family member dies. There is no fundamental core beliefs that can support them. In religious people, they are more protected in this way because they have faith in God. They know that everybody is going to die one day, including ourselves, you know. So it's more acceptable, and they have more room of acceptance to this kind of sources of stress rather than someone who doesn't have any religion. So obsessive compulsive disorder, I used to see this more back home. Especially in religious people, they become too obsessive sometimes about washing and cleaning and stuff. We see them in religious groups, but I don't see that often here in Canada. Yeah, makes sense? Jazakallah. Yes.
Assalamu alaikum, jazakallah. You did mention very good points about how to empower our children, how to raise them up. But they have maybe resources that we can go back to, read resources that more Islamic, with examples, how to raise them, how to react in certain situations, how to, apply those kind of recommendations. So if you have any resources, whether books, podcasts, anything like that, would be much appreciated.
Wonderful. So I don't have something specific in my mind now, but I'm sure if we search like parenting and Islamic, parenting, Islam, parenting, Muslims, I'm sure there is a lot of resources. I remember I had certain books about that, about parenting in Islam, especially in North America. I'm sure there are a lot of resources in this way. Yeah. Does that know you?
Any questions?
Yes.
Yes.
Sorry, about questions. Assalamu alaikum.
Wa alaikum
Question
salam.
about the bullying, especially in the teenager. It's called teenager drama. I know your patient is most likely adult, but what do you think about the bullying in school, bullying around, especially in teenager?
Yeah, bullying can be a major source of stress to students at school, and it can be quite devastating to their emotional kind of health. The best way how to handle, if you keep connected with your children, they might not talk about it. So until you ask them what's happening in school, what's happening. So staying connected with them, and if you notice any change in their behavior, sudden change in their behavior, then you need to inquire about it. Part of the inquiry is to try to have a meeting with the school teacher to ask how my kid is doing. If you identify there is bullying, you have to act immediately by communicating with the school authorities, principal, teachers, and so on, and find a way how to manage the source of bullying. At the same time, if the bullying is too severe, you might communicate with the family physician and ask the family physician to help connect your child to a counselor, someone to talk with, and to help him learn some skills, how to handle someone who is bullying them at school. Jazakallah iyaakum. Yeah.
Just wanted to check, see, I'm a newcomer to Canada and it's been a year and I have a college university going student and grade 10 and grade 3 student, So they're all in different age ranges. Just because they learn from anything, the schools and all those things, what happens to the peer as you mentioned.
Yeah.
So what I saw in few of the incidents is like they tend to become stubborn.
Yeah.
So is that something to do with parenting aspect? Like because they see that their friends going out or they're doing things and you tell them no, this is not as you said, right?
Yeah.
As per Islam, you're not supposed to be doing this.
Yeah.
But if they take it as they become stubborn about it,
Right.
So how is those things are to be managed and like?
Okay. So as we said, we have to maintain good relationship that involves respect and trust. And this relationship is not going to come overnight. It starts since very early age. So ensuring that we have a strong relationship with them to begin with, and open discussion. That what you refer to as stubbornness or being stubborn might be their search for independence. And this is the other face of it. Might be their search for autonomy. They want to be autonomous. They don't want to make their own decision. They want to be independent and separate. They don't want to be a copy-paste from their parents. Allowing them to be themselves in somehow and having more open communication, more open discussion, and in different ways, you know, in a calm way that invites them to participate in the discussion in the way I just explained, can be more effective and more helpful as compared to just telling them what they should do and what they shouldn't do. So I would, getting them, trying to get them to communities like this, you know, gathering groups. I'm sure here in Gloucester, I'm sure there is like youth group or something. The same like in BIC and the SNNC. I would support like trying to invite them to some groups like this and mosques with the Muslim community, because at the end of the day, they get affected by the kind of the group they are connected to, and they like to fit in the group. If we get them the right group, then most likely they will fit into the right pathway. Yeah, but at the end of the day, I have to tell you this. You see that I'm really happy, and it is my pleasure to try to use my profession as a tool to help Islam and Muslims. At the end of the day, this is all causes something that we try to use. At the end of the day, it is the hidayah is from Allah subhanahu wa ta'ala, guidance is from Allah subhanahu wa ta'ala. Prophet Nuh alayhi salam couldn't convince his son to go into the right path, right? Sayyidina Ibrahim, Prophet Ibrahim alayhi salam, his uncle or his father was not in the right path. So at the end of the day, our connection is to be, our hope is to be with Allah subhanahu wa ta'ala. He is a helper. He will help us. He will help guide our children. He will help guide ourselves. And we ourselves are not away from fitna. We don't assume that the fitna is only for our children. Fitna for us as well. So our hope and connection should be in the first place connected to Allah subhanahu wa ta'ala, and nasta'in billah subhanahu wa ta'ala, get guidance and help and support from Allah subhanahu wa ta'ala. So yeah, we do our best here. I do our best here, that's fine. But at the end of the day, we are limited. And we cannot reach what we want without guidance from Allah, support from Allah. Everything is with mashi'atillah subhanahu wa ta'ala.
Jazakallah khair.
Jazakallah khair.
Jazakallah khair.
Can I ask a question?
Sure.
Last question. Last question, inshallah.
Okay, Jazakallah khair.
There's another one.
Would you recommend family meetings? And if would you recommend family meetings, especially with teenagers and young girls? I see a lot of Muslim parents are so fearful that they try to sometimes overprotect their children without realizing that they are perhaps causing more harm than good. You know, they become very strict. You know, they want to impose their own model on them. So, would you think the family meeting, exchange the views, would be helpful? And if it is, what would be how they should conduct the family meeting?
Family meetings like social gatherings, you mean?
No, between children and the parents.
Between children and parents, yes, that is what we call the quality time. Quality time, family meeting, like having a movie night. Let's have a movie night. and everybody is leaving the electronics and are sitting together, chatting and watching something together, eating together, going outside together, traveling together, camping together, having some discussion. And the more you allow them to participate and talk and to present and express themselves, the better engaged they will be, the more engaged they will be, and the more responsive they will be. So yes, definitely, I would definitely recommend having as much as of quality time as a family, because it fosters more connection between the family members, the family and children, giving a safe space and safe atmosphere for children to express themselves without being judged by parents. Yes, does that
Last question to you.
What about beating?
Beating?
Yeah.
Oh.
Back home,
Wrong country.
When you misbehave,
Oh,
don't beat us.
okay, so- I'm glad you raised this question. Here is my answer. So, parenting studies show it that punishment is not helpful. What helps actually is rewarding the good behavior. When you reward the good behavior, then it becomes more happening more. But if you use punishment the way how you said, especially by being physical, you can get yourself into big trouble with here in Canada. Yeah.
If you punch your child, you'll
trouble with authority.
You might lose
your
yourself.
call the police for you.
Yeah, and I will tell you something more than that. If you become physical, you are actually solving your own tension by being physical. You didn't solve his problem. You became angry when you saw him doing something wrong, and you just released your anger by doing this. You see that? So you are actually working for yourself rather than for your child. And then you can imagine, if you hit your child, is he going to hit you back?
No, most likely no.
He will not hit you back, right? 100%. Then he will learn this kind of behavior. He might get hit outside and does not defend himself because he got used to be hit only without responding. That's very serious. So hitting children is completely forbidden here in Canada. It's not allowed, it's completely illegal, and it is not effective as a way of communication with the children. I would completely advise against it.
In Islamic point, again, so it's not
In
allowed.
Islamic part, it should be in certain way, and it should not be hurtful, and it is not meant to hurt people, to hurt children, and it is more guidance, more directive, and words always speak in better than punishment physically, of course, for sure.
You mentioned rewarding, but there should be punishment if they did something.
Oh yeah, punishment. I will tell you, punishment, but not physical. Punishment, like you are not going to you are not going to the park this weekend. You are not allowed to go to use your video game machine, this device this weekend. So you are not allowed to play Fortnite. You are not allowed to play Call of Duty this weekend. So you are not allowed to go outside this weekend. Something like that. So, but physical is completely not allowed.
Punishment in the school they have.
So إن شاء الله بالآن we'll
Yeah.
do the الآن and if you want to chat
Yeah.
after. جزاك الله خير. إن شاء الله I'll put the video on the WhatsApp group so if you can get it there. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. جزاك الله خير.